All right. So,
Hello and
Christine, are you
welcome.
good? Yeah, there you go. Go ahead.
Yeah, welcome everyone. We're gonna wait just a second while the room fills up, and I will give you opening remarks and allow people into the room. Looks like the room is still filling up. I still have people joining us. Give it 1 second, and then I'll wait for it to kind of taper off, and we'll get going here. All right. So good evening, and thank you everyone for joining us today. We're grateful you're taking the time to join Northwest Parkinson's Foundation's new expert speaker series called Communities of PD Excellence, where together we build a stronger, more informed, and engaged Parkinson's community. If you don't know me, I'm Christine Pedigo, and I'm the Programs Director for Northwest Parkinson's Foundation. And today is the third week of our 10-week local expert speaker series for the Inland Northwest. With me is local expert Sharon Hall, Doctor of Physical Therapy at Gordon Physical Therapy, and she's here to discuss the Parkinson's Wellness Recovery Program, also known as PWR. This expert speaker series is intended to be an open forum where you can actively engage each week with the local expert. If you would like to be added to the room with us, please accept my invitation to let you in. Please note that we are recording each meeting and will post for viewing on our website. If you prefer to remain anonymous, that's fine. Simply decline my invitation. You may still ask Sharon questions via the chat function. To do so, click the chat button located at the bottom middle section of the Zoom window. Simply type your question and hit send. You also have the option of using closed captioning, which can be very helpful during the webinar. To activate it, look at the bottom of your Zoom screen and click the closed captioning button. Now, to introduce to you the esteemed Sharon Hall. Sharon Hall was born and raised on a dairy farm in Cheney, Washington, where she still resides to this day. She's fond of telling people that she bought the farm. She received her master's degree at Andrews University in Michigan in 1992 and later received her doctorate degree at Boston University. She specializes in helping people with neurological conditions and earned her neurological clinical specialist certification in 2005. This includes helping people with spinal cord injuries, Parkinson's disease, and those who've suffered from strokes. She also utilizes her skills in the Gordon PT Aquatic Therapy Program. So I will allow everyone to come into the room, and then I will hand the spotlight over to you, Sharon.
All righty. Hi,
Yeah.
everybody. Okay. So, tonight we're going to talk about the Parkinson's treatment that we do here at Gordon Physical Therapy. And I always tell everybody, Christine just did a great job of introducing me. I'm not sure that was me, but, but I would like for people to know what qualifies me to do this, and she just did a good job of doing that, so I don't think I need to go any further. I've been doing this 30 years, been working with Parkinson's patients for about 30 years. Just in the last 3 years, though, I started with a technique called power moves, and I've been very impressed with the outcomes that I'm seeing. So I have two teammates that work with me, Hannah Emerson, and she's done some presentations locally of Parkinson's. And then Stacy Kent will also be joining us to help with Parkinson's program. So there's actually a team of us. First things first, let's talk about research. So the objectives tonight are to review the research on movement therapy, introduce Parkinson's wellness recovery, which is we call PWR, PWR. You'll see it in the presentation a lot. It says PWR exclamation mark moves. And that is this particular program that we run. I'm going to try to educate you all on the importance of aerobic exercise in Parkinson's program, describe 4 motor skills you are most likely to lose with Parkinson's disease, and discuss the importance of practice with multiple positions, and then demonstrate how power moves relates to everyday function. So that's kind of what we're going to get into here. So first things first, we'll talk about exercise and brain change in people with Parkinson's. And you can see when you see the abbreviation PWP, that's people with Parkinson's. Okay. So exercise and brain change in people with Parkinson's, there's a preventative aspect. Exercise reduces the risk of developing Parkinson's disease by 60% in men. So I thought that was a very interesting statistic. So if you exercise early in life, you will be less likely to develop Parkinson's. But the research has only been done in men, again, because Parkinson's happens to more men than women. There hasn't been enough research in women to give us any good statistics on that. So exercise also gives you a neuroprotective aspect. So it can halt, reverse, or slow the onset of motor symptoms. And that's huge, right? If we can continue to move and function, that's the most important thing. And then also early to advanced Parkinson's disease, there's a neuro repair and adaptation aspect to exercise. Exercise improves motor, non-motor symptoms, and or slows the rate of Parkinson's. And there's some really good research that just came out in the last year that shows with high intensity interval training and power moves that we can literally stop the progression of Parkinson's. That is crazy amazing, if you ask me. And we are proving that here at Gordon Physical Therapy doing this program. And the Power Moves group in Tucson, they've been doing that for many years. And that's where the research is coming out of. And it's crazy amazing stuff. I couldn't believe it when I saw the data on it. If you exercise 5 days a week, high intensity interval training, and some kind of power moves or some kind of functional activity, you can literally stop the progression of Parkinson's. That we never heard that before. So 30 years I've been doing this, and I never heard anything close to that. The other thing that we know is that earlier exercisers have less quality of life change over a 2-year period. So start exercising early in your disease process, and there's going to be your quality of life will stay the same, and instead of getting worse really quickly like it often does. Okay. Let's talk about multi-system benefits of progressive aerobic exercise in people with Parkinson's. So what's progressive aerobic exercise? First, we I guess better explain what that is. Progressive aerobic exercise means that we're going to start out easy on you, and then we're going to get harder and harder and harder. I always tell people when they come to see me and they want a miracle, they want to be free of Parkinson's, they want to, fly to the moon and crazy stuff like that. And I always tell them, I don't do miracles. I'm the hard work department. So if we continue to challenge people, continue to work them to their capacity, we're gonna see amazing results. We're going to prevent cardiovascular complications, depression. Exercise is one of the best antidepressants in the world. I can almost guarantee you that if I could take everybody with depression and bring them into my clinic and work their butts off, I can cure their depression. It's truly amazing because the release of endorphins and enkephalins and all that stuff, this is why people are addicted to running and addicted to riding the bike and addicted going to the gym and weightlifting, because that release of endorphins and enkephalins, I mean, that's an awesome hit, man. That's great stuff. So I've been addicted to exercise for as long as I can remember. I can blame my parents for that, growing up on the farm bucking hay. So I think I got addicted to exercise early in life, but it matters. And reducing constipation, reducing fatigue, reducing mortality, and of course stress. When I've had a stressful week and I come home and I'm maybe not the nicest person in the book, my husband's like, "You need to go ride the bike." because I can be not very nice when I'm just totally stressed out. But I get on the bike and ride the bike for an hour, and I come up a whole different person. So uh, it's a the systemic effects of exercise are amazing. We also see people have improved cognition. Of course, their functional motor performance is going to be considerably better. The How good your drugs work that you're taking is directly related to exercise. So if you're moving and your body's processing all this stuff, then you actually are going to get those drugs through your system better, and you'll get a lot more benefit out of them. Uh, I just came from the pool. Uh, we do Tuesday, Thursday pool from noon to 6. And we had a lady brand new today in the pool, and she got out of the pool and she was like, "Oh my God, I'm so tired." And I said, "Yeah," I said, one of the best things that I can think of for helping you sleep is you come and work out with us, and I guarantee you're going to sleep tonight." And she was like, "Oh yeah, I think I could sleep right now." And she said, "I haven't slept good in months." So yeah, I'm all about helping y'all sleep better. So come and work out with me, and I promise you'll sleep better. Another thing that's super important to all of us is bone health. The bones strengthen in the lines of stress. That's actually a thing called Wolff's Law. And if we don't put stress on our bones by using our muscles, by weight bearing, our bones get weak, wimpy, and break. And if that's your spine, it's very painful to have compression fractures in your spine because you didn't do any weight bearing exercise or any muscle pulling exercise. Whenever your trunk works, your muscles of your trunk work, you're putting stress on the bones of your spine. And those bones of your spine are going to say, "Gosh, this person's trying to kill me. I guess I'm stronger." And so those bones get stronger, and then you're less likely to have problems with compression fractures and all that stuff. And then, of course, when you exercise, guess what you get? You get a dopamine release. Okay. How many people with Parkinson's are on dopamine? So if you exercise, you basically get another dose of your drug. That's that's pretty cool. It's free too. How do you like that? So, getting on the bike and riding the bike hard, doing some kind of functional exercise, all of that stuff is absolutely free to you. Now, if you come to me to make sure you don't fall down and keep you safe, all that, you got to have to pay for that. But if you do it at home and you can do it independently on a recumbent bike, for example, or you can go to the Y to the pool at the Y, um, that's all good. That's all free drugs basically. So that's good stuff. Let's see what else happens. So this is again research related information for you. I'm very research focused because I have doctorate and we had to do all kinds of crazy research to make sure that we know what we're talking about. So I'm very research focused, and I want to make sure that the information that I present to you and the therapy that I give to you is research based. So this is good stuff right here. High intensity gait training repairs and enhances dopamine circuits so they are more efficient, allowing people with Parkinson's to do more with less. That's that's crazy amazing, right? Okay. How about aerobic exercise prior to balance training improves retention in people with Parkinson's? So if you do 30 minutes on a recumbent bike, treadmill, elliptical, whatever you have available, um, before you go do your balance training, before you do your power moves, before you go out to rake the yard, you're actually going to be more able to do that and less chance of falling down. So that's good stuff. Um, Intensive rehab, functional motor and cognitive challenge uh, helps you to improve your motor systems. So in power training, we do a lot of multitasking. So we'll have you practice walking with great big steps and big arm movements and doing the alphabet backwards or doing serial threes, 3, 6, 9, whatever. Um, some people tell me that they couldn't do that before, so we let them do more simple things. But I have people tell me stories. I love listening to people's stories. It's awesome. Uh, I have people tell me their birth dates of their family members. So we're getting your mind to work as well as your body, and we see really nice improvements in people with those both challenging both the functional and the cognitive at the same time. Okay, functional training is multimodal and has greater retention than single mode practice. Okay, what does all that mean? And it also requires more cognitive engagement. So what does that mean? That means that if I have you rake leaves, for example, or make me a batch of brownies, that is going to be much better for you than if I set you down and say, okay, lift this weight 20 times. Okay. Single mode. That's called single mode practice. So I'm just gonna have you do this one thing 20 times. Okay. Zippy ding dong. That's boring as all get out, for one. And two, you're gonna get, two muscles exercised. However, if I have you rake leaves or make me a batch of brownies or shovel snow or come to the clinic and do a bunch of power moves, that is going to provide significantly better retention, and it's going to get all of your system going, your brain, your body, everything going all at once. So I love functional training. I am so functional based, it's kind of ridiculous. I had a gentleman this fall that his assignment when he went home was to rake leaves and literally bring me the leaves. Okay. So I have a very large garden and I have no deciduous trees. So leaves to me are like gold. And so I got to do a very functional task. And I got some leaves and it was grand. It was grand. We've had it all figured out. So there's other tons of other things that people do. I freak to make brownies or cookies or you could suppose make me something healthy, but that would be kind of boring maybe. But that functional task of making brownies, that functional, or to sweep the house or vacuum the house, those functional tasks require so much more muscle and so much more brain muscle that they are way better than anything else. So I love function. I try to make everything functional. Part of that may be my growing up on the farm, right? Um, we didn't do a lot of straight plane exercises. Okay, let's see. Anybody got any questions at this point?
It does look like there is a question that came in. What is your THR? I don't know what that means.
PHR. I don't even, what does that mean?
THR. I don't know.
Bonnie Mandel raised her hand.
Yeah, I
What do we
see
do
that.
about that?
Go ahead, Bonnie.
So I can't get a thing into the Q&A session. Can you hear me okay?
Yeah, I
Yeah.
can.
Okay, so could you explain what is high intensity gait training?
Okay. Yeah, absolutely. I'm happy to do that. So uh everybody is different, right? So high intensity gait training may mean just walking circles around the clinic for one person. It may mean we go outside and we find uneven terrain, hills, jumping over logs, whatever. Everybody's high intensity is going to be individualized. So we do heart rate numbers. So the if I say the maximum heart rate for any person, we take 220 and then we subtract your age, and that gives us a ballpark maximum heart rate. I don't want to get to that. Okay. I want to get somewhere between 50 and 80% of that. So we take that number, that 220 minus your age, and we multiply that by 0.5 or 0.8, and then we get the heart rate, that zone that we want you to stay in. Higher end of that heart rate zone is going to be your high intensity work. Okay. So let's say, like for myself, so low end for myself, it's about 125 heart rate. High end is 170, 180. Okay. If I want to get the maximum benefit out of my exercise, I need to be at about 150 to 170. That's high intensity, and that is killer. I'm sweating like a dog. But that's where we need to be to get those endorphins and enkephalins and that dopamine moving. So the high intensity interval training that we do is 20 or 30 seconds on, where you're pedaling as hard as you can and as fast as you can, and then you get a 40-second rest. So 20 seconds out of every minute for a 30-minute session, you're working your butt off. And that gets all this stuff moving in your body and your brain, and really, really makes a difference in the next part of this session, which then becomes walking. And so high intensity walking may have to be like on a treadmill, with a big old hill. But for other people, it may be, like I said, just barely trying to get around the clinic. So yeah, it's different for everybody. And that's why, we here at Gordon, we take each individual person and set a program for them. Okay. Any other questions?
I think the person who asked what THR had
THR?
had their hand raised, but I see that it's gone down now. So if you want to submit something to the chat, or retype that out, whatever that stands for, that would be helpful. And I saw another question in the chat, so let me go back over to that. And it was a comment. Oh, so this person is mentioning that their husband has hypotension, and so the high intensity training isn't possible for him. What are your thoughts on
So,
how do you want to
okay.
that?
Okay. Yeah. So first we have to figure out the difference between hypo and hypertension, right? So
Yeah.
hypotension is low blood pressure, which is very common in Parkinson's. And
Yep.
exercise is actually a very good thing for that population. If they have hypertension, then we have to be more careful, because we don't want to increase their blood pressure any further and make things a problem. But the majority of people with Parkinson's actually have low blood pressure. So if there's a low blood pressure problem, I'm not worried about that, because I can make it better by getting some high intensity exercise involved. So, and again, I've got blood pressures, cuffs, I've got stethoscopes, I've got all the gear here. So I am very good at recognizing when people are struggling with cardio things, because a lot of people with Parkinson's also have cardiac issues. So I'm watching for that. I'm kind of like a hawk on that stuff. And we have a couple of gentlemen right now that we're working with that definitely have cardio problems, and we're on it like a hawk. So
Any comment to him passing out with high intensity?
well,
Sounds
so
like AFib, hypertension and AFib. So
yeah, if it's a hypertension, again, we got to be careful with that. I mean, and they should be treating that with medication, it would be my guess. And AFib, yeah, we're going to be a little bit more careful with that patient, but they can tolerate, so high intensity to me is, get on the bike and ride at 20 miles an hour for an hour. But high intensity for that guy may be get on the bike and just make the pedals go around. So
yeah.
again, it individualizing it for each person is why you come to physical therapy. If you could do it yourself, you'd be doing it, right?
Yes, fantastic. Thank you. That's very wise, individualizing it for sure. I can't certainly do what I used to do 20 years ago. Marty, it looks like you have your question or your hand up. Would you like to ask Sharon a question? You're still muted, Marty. All right, I have another question. Could you say again where the POWER program research comes from?
So if you look up Power Moves, and it's an entire program that's run out of Tucson, Arizona. And it's a certified program, and they've got a large body of research information there.
I'll put the link to their website in the chat for everyone.
Yeah, it'd be awesome. I'm going to show a couple videos later of the actual Power program, so you'll see some of that.
Excellent. Marty, go ahead. I see you're unmuted now.
Yes, I know I was running around trying to get my dinner in and everything, and I really appreciate this. So is Alice, is this your name? This gal's name? Is Alice?
Sharon.
Okay, so Alice,
Oh, Alice on the chat. Yes.
Oh,
Mhm.
no, Sharon, that's right. Sharon, so are you certified as a mobile specialist or a movement disorder person?
I
that-
am neurologic certified specialist, which is a certification by the American Physical Therapy Association that took me years to get. But
Yeah.
I work with all people with neurologic disorders.
Yeah. Okay, thank you.
Okay, shall we go on?
Yes, please.
Okay, perfect. Here we go. So what is Power Moves? So we use Power Moves here in the clinic because what I have found is Power Moves works better than anything I've used. I've done big, LSVT big. I've done lots of different kinds of therapies for Parkinson's, but this literally works better than anything I've ever done. So, and it's fun. So I think all therapy should be fun. It should be hard, but it should be fun. So I think Power Moves is fun, and therefore I really enjoy it. So what is it? Power Moves are practiced in multiple positions and made progressively more physically challenging all the time and more cognitively challenging all the time. I think that's huge. We use a different target for each person's unique symptoms. Of course, we individualize every single program. Power Moves helps mitigate symptoms, and it helps to rebuild function. In our group that we have right now, we haven't had a single person regress. Everybody that's coming right now to the group that we're running is meeting functional goals. And we do standardized testing, and they're meeting their standardized goals. So all the standardized testing means that we took, I don't know, thousands and thousands and thousands of people, and we did this test on all these people that were totally normal, no healthcare problems at all. Okay. So when I test you, I'm actually looking at all of those people that were perfectly normal, and we call those age-matched norms. So I'm testing you against age-matched norms. Okay, well, that might not be entirely fair because, a lot of people have a lot of problems. But I want to know, how close are you to that age-matched norm? And I will tell you that right now, our group is moving closer and closer. Every 8 weeks, we test, or it could be less than that. Could be 30 days or 8 weeks. And every 30 days, we do a progress note. Every 90 days, we do plan of care note. And I'm doing testing at every interval. And it's amazing to me that our guys are all moving closer and closer to their age match norms at every single test. That is amazing. Okay. I've got people that don't have Parkinson's that can't do that. Okay, so, and it's such a fun group. So anyway, so Power Moves works. That's what I know. Okay, so let's talk about we're gonna talk more about Power Moves. What starts with building blocks of function. Anti-gravity extension. What's anti-gravity extension? That means stand up tall, get up and out. Okay, weight shift, right? It's difficult. It's very difficult for some people to weight shift. They get stutter, 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 stand, stutter, 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 stand. And what we're trying to do is step out, weight shift, get your body moving one direction to another. Axial mobility. That means we're going to turn on your skeleton. Okay. We're actually rotating around ourselves. And then transitions, going from sit to stand, from the floor, to stand, from the bed to sit. So we're doing all of these really cool transitions that a lot of people are scared to death of. How many of you really want to be on the floor, right? I get people are like, no, I'm not getting on the floor. But everybody that's in our group right now has been on the floor here. And we use mats and all that kind of stuff. So nobody's going to get a knee injury or anything. And we have people with multiple problems. We have people with knee replacements, shoulder problems, all these things. So we can accommodate all that stuff. We can manage all that because we're familiar with all of it. It's no big deal. Okay. Exercise for brain change, learning essentials. This is huge. The physical effect, constantly challenging people, not just physically, but cognitively. But we're moving people outside their comfort zone. When I say I've had every single one of my guys on the floor, they weren't thrilled about that when we first started that. They're like, no, I want to go on the floor. And now, they're fine with it because they know that, for one, they're going to get back up, and they're not going to get hurt. And you know what? I'm getting kind of good at getting off the floor. So that's a really good thing, right? So that's huge. And then knowing the steps to safely get up, to safely move your body in all these different positions. This is huge. Okay, the other thing that's awesome about this power move stuff is the emotional engagement. So these guys are awesome. They communicate with each other really good. They're starting to gang up on me. I'm not sure if that's good or not, but we just had one of our gentlemen end up in the hospital. And everybody signed a card and sent him well wishes, and people are calling each other. The wives, so the wives, they come in, they drop off the guys, and then they all go to coffee, and it's really, really good for them. And the guys give each other a hard time, something terrible, and when somebody's sick or can't come for some reason, everybody's like, hey, where's so-and-so? Why didn't you show up today? Well, we better call him because he's supposed to be here. So it's a really fun group. The cognitive challenge, constantly challenging one another. We got some people that are more cognitively challenged, some people that are more physically challenged, and they challenge one another, which I just love that aspect. It's so good. And I've done a lot of groups, in not just Parkinson's, but other aspects of care too. I've done spinal cord injury rehab for many years. And I know the power of a group. And it's so much more powerful than anything else that I've done. I love it. It's easy to kind of zone out and not pay attention if you're exercising by yourself. But if you're in with other people that have like problems, and you're talking to one another and you're trying to help each other, that really helps your cognitive challenge, your emotional engagement, and your attention. So all of those aspects are super good for your brain. And we're excited to see this group grow. Okay, Christine, we
All
have
right.
a
So
video to show.
yes, if you want to stop, I will I will share my screen, and the audio wasn't working when we had it on hers, so we have to play this a little differently. So hopefully it works for you all on mine. And
Targeting, stretching, strengthening, and balance. We practice power moves 3 different ways. The first
like
way,
that's-
the way that we
didn't
tell everyone
start
to
right.
start your power moves practice so that you get them.
can you not hear it? Could you not hear it?
I can hear it, but we got to start at the beginning.
Oh,
It started 30 seconds in. There we go.
Hi, I'm Jennifer. Welcome to the introduction to power moves. Power moves are done in 5 positions: standing, sitting, all fours or hands and knees, on your belly, and also on your back. Each of these positions is important for daily function, as well as targeting, stretching, strengthening, and balance. We practice power moves 3 different ways. The first way, and the way that we tell everyone to start your power moves practice so that you get the most out of your power moves in any position, is to prepare. Prepare allows us to rehearse each movement slowly and with increased attentional focus, allowing us to get the greatest range and quality. When you prepare your power moves, you will help gain flexibility and fight the symptom of rigidity. The second way to practice is to activate. Activate focuses on high effort and repetitions of big and fast movements, while maintaining that high quality and range of motion you attain during your prepare. Activate is intentional, vigorous, and it's going to help you fight the symptom of bradykinesia. The last way to practice is to flow. Flowing is going to challenge your cognition as we link the power moves one right after the other in a sequence, very similar to everyday life. Practicing the power moves in flow will help you fight the symptom of incoordination and improve your balance and fluidity of everyday movement. So again, there are 3 ways that we practice the power moves. Prepare, to really focus in on rigidity. Activation, to target bradykinesia. And flow, to improve coordination. With that introduction, you can think about every practice that you do should include a prepare, should include some activation, and then challenge yourself with those flows.
all right, you can go ahead and share your screen again.
All right. So that gives you, hang on, where are we? There we go. Okay. That should give you a little bit of an introduction to power. These slides are just showing you some of the different positions. And a lot of times people are scared of the different positions. Standing,
Sharon,
maybe not so much, sitting, not so much, but definitely when they start getting down on all fours, people are nervous about it, but don't be, because we do it a little bit at a time and make sure everybody's safe. So this
We
is,
can't see your
this gives you
screen,
just
Sharon.
kind of, what's that?
We can't see your screen.
Oh, you can't? Why can't? Okay,
No.
hang on. Let me escape that. Let's go
And
to here.
I know we
Now,
had
can
a
you?
few, no.
Okay, hang on. Let's go back here. Gonna go here. Go up here. And here it is. Better
Looks-
now?
Yes, we can see that. Yep. You wanna
Now I'm gonna
slide?
go to presentation mode.
Yes, perfect. Thank you.
Come on. Come on, machine. There we go. Okay, now can you see?
Yep, perfect.
Perfect. Okay, so I'm gonna go back one minute. Okay, so this is just the power up. So each one of these moves has name, and it is directly related to function. So this is basically just getting from sit to stand and standing up straight and really getting that full extension. Look at the fingers, the hands, the arms. I just love all that beautiful extension, because Parkinson's tries to drag you down, and it's great to practice the opposite of what the Parkinson's is trying to do to you all the time. So power up in sitting. This is a very basic one. Pretty much everybody can do this one. Start sitting fairly tall, then bend down like you dropped a contact on the floor, or you dropped your sock on the floor, and now you got to get down there and you got to get it, pick it up. And then we go back up into that nice wide position to get everything unstuck, get those bodies moving. Here's the one in kneeling. Again, so we've got power up. So we're going to go start in all fours, and then you kind of rock your bum back, and then up on tall knees. This is how you get off the floor. We're going to basically be teaching you how to get off the floor by doing the power moves. Every single one of these moves is totally function. The next one is one of my favorites. It's called the power rock. This is just big weight shift. So we're accentuating every single move to the maximum. Big wide hands, stretching and reaching as far as you can, shifting that weight all the way over. Somebody told me the other day, said, well, I don't need to practice standing on one leg. And I said, well, you don't? Why don't you? Well, I never stand on one leg. And I said, yeah, you do. Every single time you take a step, you stand on one leg. Now, might be for a short period of time, but the slower you walk, the longer you have to balance on one foot. So this kind of activity prepares you actually for walking better. The seated one is great, trying to reach over. You drop something on the floor. Now you got to reach over and pick that thing up off the floor, especially if it's your remote for your TV, right? It's football season. If I drop my remote, we're in serious trouble. The lying down one, this is all prep for rolling over. And I know a lot of people have problems rolling over in bed. That's actually a very difficult thing with Parkinson's, is that your trunk gets so stiff that you have really hard time rolling over. So that's the power rock. It's all about weight shift. Power twist. So the power twist is just literally about transfers. So you start out with your hands wide, and then you twist your whole body around and go to that other hand. And you do that in all these different positions. And the one on the floor, everybody's like, I totally can't do that. Can you see my cursor? No, maybe not. Anyway, so the one on the floor is one
Yes.
nobody thinks.
We
Yeah,
can see your cursor.
the one on the floor is nobody thinks they can do that. And every single one of my guys now can do this. So that's a hard one. It's called the thread. You literally get on all fours, and then you thread your arm underneath and come out flying with that hand. And it's actually kind of a fun one. The seated twist, again, you're reaching over to grab something on the bedside table, or you're reaching over to get something off the stand beside your recliner chair. When I was doing home health, we used to call the place that people have around their chair their nest. Because they got 3 tables around each side and all this stuff. So for you to be able to go get something for the table beside your chair, you need to be able to do that motion. Okay. All right. And then there's power step. And you can see this one is one of the more advanced ones if you start on all fours. But in sitting, it's just moving. It's transferring. It's moving yourself from one edge piece of the bed to the next piece of the bed, to maybe get closer to your walker, closer to your cane, or, you just getting up and getting going in the morning, sliding over on that shower bench to get into the shower. All very functionally based. That's why I love it. Okay. So power moves here at Gordon Physical Therapy, obviously an individual evaluation. We ascertain the needs, we do standardized testing, we do baseline functional testing, and we set some goals. And it's not my goals, it's your goals, because my goals don't matter. I have to do standardized testing to show that we are making progress. Otherwise, the insurance company is going to shut us down. But your goals are more important to me than anything else. So if you want to climb a tree, okay, we'll work on climbing a tree. I don't know, whatever you come up with, I'm good. And I want at least 3 or 4 goals of your choice, and then we'll have our standardized testing that we do. So the education on how to stop progression of Parkinson's, that's another part of just getting started. We talk about high intensity interval training, which we've talked about already, and we talked about when we talk about power moves, functional training. And then we start training you with the 4 basic power moves that we just saw on those slides. Okay. Once we get all that done, and you're a rock star at all that, then you can go into the group therapy. Because in group therapy, there's multiple people all at once, of course, and everybody kind of needs to be safe. There are 2 or 3 of us guarding when people are practicing their skills. So it's not going to be like you're alone and, just flying solo. That's not going to happen. We're right there, and we're generally push to make sure you work hard enough. So we do a ton of balance training. We do a ton of gait training and function. Okay. The other place that we can do all of this amazing work is in the pool. And if people have really bad joints, bad hips, bad knees, all that stuff, and land high intensity work is too much, just can't do it, hurts too much, the pool is the best place in the entire world. I told a lady today, she's 98, and she has been swimming since she was 8 years old. So she's got 90 years of practice in the pool. That's an amazing lady. But I started swimming when I was 6 months old, and I have never in a single year of my life not done some kind of pool swimming. I was a competitive swimmer, went to college on a swimming scholarship. So I love the water. The water is absolutely my second home. Probably have gills somewhere here, but I'd rather be in the water than anywhere. So Tuesdays and Thursdays, we're in the pool. Hannah, myself, Stacy's going to end up with us. We have another gal, Tara, that works with us as well. And we're in the water working with anybody who wants to show their power moves are amazing in the water, because guess what? You don't have to worry about falling down. We will catch you, keep you from drowning, but you're not going to get hurt. And the compressive forces of the water, I could go on and on and on about aquatic therapy. But research shows us that aquatic therapy is the single best method of improving function in people with Parkinson's. That's impressive, right? So even if you're afraid of the water, you can come and I will teach you not to be afraid of the water. Promise. I taught my mother how to swim. She nearly drowned when she was a child, and I taught her how to swim. So I will take anybody. You can be absolutely petrified, and you can hang on to me all you want. I've had bruises before from people hanging on so tight, but we'll get you in the water and we will help you move, because the water is crazy amazing. All right, we're ready for that next video. And if you want me to get out of this mode,
I already did it. I'm on
perfect.
it.
Woo!
All right. You can see my screen.
I was diagnosed with Parkinson's in 2015 after having a brain scan. My left hand was tremoring. 6 years, I did not take any medication. All of my medication was through exercise from the Power Gym.
Initially, when I was diagnosed, I'd gone through a period of depression, hopelessness, and just a lack of drive.
Earlier this year, I was diagnosed with Parkinson's. I started coming to PWR about 2 months ago, and I personally feel it has totally changed my life. You have to embrace it, and I'm not going to give up.
When I first heard about Power, I was immediately blown away by the people I saw there that were being helped. So it sort of felt like I found a home, my tribe. I could identify with those people.
The peer relationships are terrific. My fellow workout buddies, we're fist bumping, we're supporting each other. We all work together because we have a common issue that we're facing, and we deal with it.
People are fortunate that walk in through the door of PWR. It gives them a tremendous advantage over Parkinson's. It's made me a better person.
Early on in my journey with Parkinson's, I sought out physical therapy from local therapists. And you'd be lucky if you found somebody that had maybe worked with somebody with Parkinson's here. When I go to a physical therapist, I know that they understand Parkinson's and how to deal with the various aspects of people with Parkinson's.
I feel more confident about when I walk and stepping. The last thing I want to do is fall. I want to keep my mind and my body active. PWR has done it for me.
Every 6 months, I get an evaluation from a physical therapist. The last time I did it, my sit to stand was still 8 unassisted in 10 seconds. And I'm confident that I would not have been able to do that without the work that I put in with the Power Gym. It's a nonprofit doing tremendous work and a big difference in the lives of people with Parkinson's.
Fantastic. Thank you.
All right, we're back. Everybody hear me?
Yep.
Okay, here we go. So take home notes. Practicing the same small, slow movements over and over again without paying attention to your quality of movement will not improve you. Promise. Okay. I think somewhere there's a definition of it was stupidity or something that says it doing the same thing over and over and expecting a different result is definition of
Insanity.
insanity. Is that what it is? Anyway, so yeah, that's not going to help you. You need to be engaged and challenged physically and cognitively if you're going to improve. Okay. That's my job. My job is to work you hard enough so that your body will say, oh my gosh, this therapist is trying to kill me. And therefore I have to get stronger. And that's kind of like, I know this is going to sound weird to you, but that's kind of the concept of physical therapy as a whole. My job is to challenge your body enough to have it accommodate to that challenge. And therefore you get better, stronger, 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 stronger. Okay. One of the really important things is that you get feedback about the quality of your practice. And that is best done in a clinic with somebody who knows what it's supposed to look like. Okay. You need to learn what to pay attention to during your practice so you recognize when you're moving at your best and when you're not. So we give constant feedback. We're constantly saying, good job, that was great. Yeah, no, that was terrible. We're not going to do it that way again. Let's try it this way, you know. So that feedback is super important. And we try to find, because there's different ways of doing that for everybody. Some people respond better to tactile, my hands on their body. Some people respond better to just words. Some people respond better to sounds. I'm sadly notorious for my weird sounds. If somebody's doing something wrong, I'll be like, I give them the noise, and they make fun of me for it, but I still do it. Okay. It isn't enough just to exercise vigorously and then be inactive the rest of the day. You gotta move. You gotta keep your body moving. The famous saying, use it or lose it. I mean, that is so true. One of the other favorite sayings that we use in physical therapy is motion is lotion. Your joints need you to move. Your body needs to move. The lubrication system that we have in our bodies is movement. So when I go out to run my tractor, there's a thing called a Zerk fitting. I stick a grease gun on that baby and I pump it up and I get a bunch of grease into my tractor. We have internal Zerk fittings, and that's movement. Every day, using your body, getting better, stronger, faster. Okay. We do that here, power moves and high intensity interval training. Hannah and I, again, are both certified, and Stacy is getting certified. So there's the crew. That's me all dolled up, not just from the pool. And then Stacy's in the middle and Hannah's on the far right. So that's your crew. Thanks.
Excellent. Thank you so much. We have an active and busy chat. We had a few people come in late. So if you're not in this room and you'd like to be, please raise your hand. I'm going to just call you out. Ruth, I've seen your hand up for quite some time. I'm going to send you a panelist invitation. And if you'd like to join us to actually ask questions, you can, or you can submit them via the chat. And so there's a few of you. We have questions in the chat, and I'll read those off to you as well.
Great, thank you for helping me get in.
Yes, Ruth, go ahead, ask your question. You've been patient waiting.
That's all right. I don't know if I remember the question I had before, but I do have a question, and that is, where did you say this program is, and do we have anything in North Seattle like it?
That is a good question. I do not know the answer to that question in Seattle. What I would suggest is that you go onto the Power Moves website, and they actually have somewhere on the website, it shows every city and it shows all the certified therapists in every city. So you can definitely look that up on the website and or just contact them and they'll tell you.
All right, thank
Yeah.
you so much.
Ruth,
Yeah,
I'm gonna
good luck.
I will submit the link for the professional directory in the chat right now.
Oh, great.
Awesome.
Don't let it slip away.
I won't. Let's see. Takes me a while to navigate. I have a question that came in before, while I do this. This gentleman wanted to know, how do you alleviate the symptoms of heavy legs? Some days I feel like I have 300-pound iron boots on.
I hear you. Yeah, no. Believe it or not, just getting those legs to move. I think the best thing to start with is actually getting on the recumbent bike and moving on the recumbent bike. Getting things loosened up, getting that dopamine release, getting endorphins released on the bike is the best way to start. And then once you get into it and you start moving every day and doing the big moves, doing the power moves, suddenly it's like, you lost 150 pounds off your legs. It really truly is amazing. I've had people that, they come to the pool with us and they're in the water and they just feel like they've lost 300 pounds on the way into the water. It's amazing. Now, unfortunately, when they get out, they say they gain 500, but being in the water really helps to loosen up the body. It's a warm water pool. It's somewhere between 88 and 93. It varies, especially with the crazy weather we've had, but it's a warm water pool and that also makes a difference. That warm water loosens up the joints, loosens up the muscles, and really does help people to move. So finding an aquatics program in your area is amazing if you have 500-pound legs.
Excellent. Thank you so much. So we have some more questions. This one is Power Moves a package that a client is to purchase?
No, not at all. No. In fact, I think in the last video, it's a totally nonprofit program. So the Power Gym that's in Tucson, it's gigantic. You saw it in the picture. Holy crap. That's like a dream to me to have a gym like that. Holy crap. I told Luke, the owner here, I said, Luke, we need more toys.
Yeah, that looked
When-
like a lot of fun.
Oh my gosh, that place is crazy. I'm actually going on vacation down there and I'm going to go to the Power Gym and then I'm going to take a video and I'm going to show Luke we need a lot more toys. They have a lot of stuff. We only have a few toys here, but that's it. The amount of, opportunity of having a place like that is totally amazing. We don't have anything close to that.
And so just so we're clear from your presentation, people start out with a power physical therapist with individual therapy,
Correct.
right? Individual
Correct.
personalized therapy, and then they can advance to the group sessions and do it with collaboration, camaraderie,
Mhm.
right? Or they can do it also in the pool at your gym in
Yep.
at Gordon Physical Therapy.
Yeah,
So
and
yes.
yeah, there are other programs around the country that do the power moves in a group setting. That I it's like a Y or whatever, and they don't charge for those. We do physical therapy here, mostly with more of the lower level folks to get them up to speed. But I've got quite a few patients that have come in, they've learned how to do the program, and then they're totally doing it at home.
Great. And you're in Spokane, Washington, right? Or Spokane Valley?
Correct.
Okay,
Spokane
and then
Valley.
there's a question, okay, Spokane Valley. So there's a question, is there a physical therapist in the Coeur d'Alene area, do you know of, that does the power moves?
Not that I know of.
Okay. And then this says, how is this program different from LSRV, which I'm thinking they're thinking is,
LSVT.
yeah, LSVT, I think.
Yeah.
Yeah.
Yeah. Okay, so I've done both. I was LSV certified years ago. I've done both. And believe it or not, power is simpler. So LSVT, there's a lot of exercises, and some of them are very functional, and you know, the focus on big is absolutely important. I think this program is more simple and it's more functionally based. So that's why I like it better. And it's way more fun. So I'm all about the fun. LSVT is kind of a rote set of exercises, and personally, I kind of get bored with it. But this is like, I can be as creative as my brain can possibly be as a therapist, and all it does is make people better. And so power's more fun, and I think it's more functionally based.
Excellent. Thank you. There's a lot of questions about where. So I hope everyone sees the professional directory of how to find a program, hopefully near you. There is one that says, is there a way to do this program virtually for those of us who travel? Yes.
Yes.
Talk about
Absolutely. Go to the Power Moves website, and there are a bunch of virtual classes there. Now, I caution you that if your balance isn't great and you are nervous about doing some of this stuff, please don't do it alone at home, because I don't want people falling and then blaming me because I told you to go do power. Okay. And I'm sure it says that on their website as well. So be careful. And if again, just even a few sessions with us here to help make sure that you can do these moves safely, I think is important, or any other power moves group in the country. But I don't want people getting hurt trying to do things they're not ready for.
Okay. Thank you. We have, I see the hands up. I'm going to just get to the last question I see in the chat, and then I will let you guys ask your questions. So this is from a local person in the Spokane area, and they want to know, when does the Power Men's Group meet? Is there a men's group?
So we do, well, it could be ladies too. We don't have any ladies right now.
Oh, okay.
So we're not discriminating.
Got it.
So on Mondays and Fridays at noon is when we work with the high intensity training and the power moves. But you do need to get an appointment because it is physical therapy. So it has to have the doctor's order and all that jazz.
And insurance coverage, can you speak to that just a little bit? How well is this covered? Main Medicare, Medicaid, commercial insurance?
Medicare, yes. Commercial insurance, yes. There's a few insurances that we don't take. I don't even know what they are. You'd have to call the office and figure that out. But yes, we absolutely Medicare. We do VA clients. We don't take Medicaid.
Okay.
We do have, however, if they're Medicaid and they can cash pay, we do take cash pay.
Okay. I just put in the chat the Inland Northwest flyer that has all of the people's contact information. So Gordon PT is on that list, so you can call them and make an appointment if this is the program that looks right for you. So Madi, I see your hand up, and Ruthie, I see your hand up. Madi, go ahead, and then Ruthie, we'll get to you. Madi, you're muted. Unfortunately. Oh,
Sorry.
there we go.
Sorry. Okay. I actually got my question answered. I didn't know how to take my hand down.
Oh,
So.
okay. And Ruth, I saw you had your hand up, and Ruthie, I see you. Ruth, did you lowered your hand? So are you good?
I forgot my question.
Oh no.
Take Ruthie first, and I'll come back
All
to
right.
me.
Ruthie, You have the floor.
Okay,
Close us out.
it's excellent. And of course, there are a lot of different programs. I just happen to have been with Dance for Parkinson's for quite a long time now. And I know my physical therapists, you know, in other words, when I was with some of the physical therapists, whenever I needed to say, well, I've got to go for an appointment, wanted to cancel one or the other, they told me never to cancel my Dance for Parkinson's. And Ruth, we are blessed, Ruth Schultz, to have the people that we have with Dance for Parkinson's, whether that's a volunteer, where it's a program where it's a nonprofit. And I'll be back, by the way, Thursday. My injury is better. Back here on my.
I look forward to
back.
seeing.
But anyway, I wanted to let you know that a lot of the things that Sharon talked about, we actually do in our Dance for Parkinson's, and so they address quite a bit of of the LS, all of that other. They address what it just depends. It's not all at one time, but we get all of that. So it would be nice to have a program here, but anyway, if you think about it, you'll know that we do a lot of those things. I didn't know you in the very beginning of the Dance for Parkinson's classes that I was taking, but you've been in the last one that I've been in. And so I just thought I'd let you know that I have missed being with you. And that group is an excellent group as far as we've made a lot of friendships there. And so I don't know whether everybody's back or not, because I haven't been back for the winter yet because of my injury. But anyway, just thought plugs for Dance for Parkinson's.
Yeah, that's a great program.
And also because a few years, I don't know, a year or two ago, it seems as though I was having problems. And I think they were reading my insurances wrong, because I have the top insurance. And anyway, they were thinking I had something else that I didn't have. And it was frustrating. And I thought, okay, if I can't do the physical therapy, or they tell me I'm too good, I don't need it, and all of that. And I'm 85, and I'm not going with you said something about age. And I'm 85, but usually they say, well, you don't need this and you don't need that. Well, I do need it. And that's why I go with the Dance for Parkinson's, because then I don't have to fuss or advocate for myself as far as why I need to go. I don't like that. So therefore,
thank you, Ruthie. Yes, thank you, Ruthie. Thank you. We're a little over time, so I don't mean to cut you off, but I want to make sure everyone else has a chance. And I have some closing remarks. So thank you so much, Ruthie. Ruth, I see your hands back up. Did you have any last questions?
Oh, I was just going to ask a question about arthritis and knee problems. I'm 85 as well. And I find some of the things that I was doing, to be difficult to push through because of the knees or the arthritis in the lower back. And so I'm assuming that where Sharon is, that you all do that assessment, and so that it really appeals to me. I hope I can find PWR here.
Well, and that's why we're doing aquatics. So we'll do power in the pool, and the aquatics is absolutely the greatest place in the world for people with low back problems, with hip, knee problems. That's why we have that program, and it is very full. So
thank you.
Yeah, it's awesome.
I would just say, we can, anyone who's here on the western side of the mountains that's interested in power moves, Dr. Marcy Nemhauser at Northwest Parkinson's Foundation, this is one of the things she does, is she helps people locate programs that are designed for people with Parkinson's that are in their area. So she can absolutely help you, Ruth, or Ruthie, or anyone else who's interested in this program. So with said, you guys, we are a little bit over time, and I want to be respectful of everyone's time. If anyone has any last questions, I will open it up for one or two more, and then I'm going to close with closing remarks. I think, are we good? All right. So thank you for joining us again. Next week on Tuesday, January 30th at 5:30 p.m., we have Linda Lee Derek Torrey and David Baumgart from Pass to Pass, and they're going to present the many ways to prove you are unstoppable by participating in one of their amazing day or overnight guided hikes and adventure tours. These are designed specifically for people living with Parkinson's disease. I know there's many people who have been on this in the Communities of Excellence webinar series that have done it. And I truly cannot wait to volunteer and go on one of these myself. And I think that if this interests you and you want to get a head start, that doing the Power program would be a great way to get in shape for it. So to join us
You'd have
next,
to have snowshoes for us.
snowshoes. Oh gosh.
Christine, we also Spokane meets on that day.
What's
We
that?
have where's Sally? Come back. We meet on that day. Where we have a PD Connect.
Yes. Mike and I spoke. He's going to see about having it at the church, a Zoom meeting for everyone to participate.
Ah, nice. Okay. Cool.
Yes. So
Okay.
it's the same link to join next week as you used today to access this meeting, and you'll use the same link to access all the future meetings. Once again, I did put in the chat the link to download the black and white PDF. So you have all the contact information for everyone who is in the speaker series, and to learn more about our free virtual in-person wellness programs, visit our website at www.nwpf.org. So with said, if anyone doesn't have any more questions, I will say thank you so much, Sharon, for
You too.
participating and giving us your time today. This was exceptional.
No problem. I would love to see anybody who wants to come.
Great.
Okay.
Thank you
Thank
so
you.
much. Have a good evening,
Bye.
everyone.
Thank
Thank you,
you.
Sharon.
Bye.
You're
Thank
welcome.
you.